me, it is a different walk in the park because I'm kind of that irregular egg. Um, I'm not oval. I'm kind of triangular shaped or something. Uh, I'm a veteran, so I have my VA benefits. Um, Ironically, though, my mother was diagnosed with stage 2 back in March of this year. And again, there's no genetic predisposition, there's no connection to anything. And I can't help but think that it's not some kind of an environmental uh, influence. I don't know if it's in the chicken we eat or the fish that we fish for or what it is, or maybe it's just in the water we drink. I have no idea. But, for her, being retired for 20 years, um, her insurance or health insurance is quite expensive already. Now, if and she's not mom and dad are not wealthy. They've been blessed that they've been able to retire early, but she's 79 years old now, and for her, um, the money, it's not run out yet, but it's not going to last forever either. So there probably is going to be a point in their lives where they're going to require Medicaid, and with a predisposed, pre-existing condition um, like cancer, I don't know how that's going to affect. Currently, I think it's an acceptable we have an acceptable Medicaid program that will allow her to do that. But that's why I was down on the Hill this past couple of days, was to make sure that the new bill that was trying to be passed would fail, and we're blessed that it did. Of course, we don't know what things change, and in Washington's things change at least every 4 years, if not more regularly. So it is what it is. And I think that it's, when I look at my wife, she's been employed for the same business for 15 years, but there's no sense of employer-employee loyalty. The employers at any time can say, you know what, we don't need your position anymore. We're going to downsize. We've been bought out. Any number of things that could happen. And if that were to happen, we would have to go on Medicaid for her. Our finances just don't allow for it. So, the insurance aspect is certainly something to consider, not just for ourselves, just because we're afflicted with this disease of breast cancer, but it really, the insurance systems that are in place um, need reform desperately. And I hope that nobody in anybody's family that would be watching this, I hope nobody's in that situation ever. In a perfect utopic rose-colored glass world, it would be wonderful if there were free health care for all. And in this country, especially in America, supposedly the greatest country in the world, and I've had the benefit of traveling and seeing a lot of the world, and I have a hard time arguing with it to say that it is anything but the greatest country in the world. And yet, in spite of that, it doesn't take care of its American citizens first, and that's what it needs to do. And especially with healthcare, with respect to our healthcare. I mean, we know that there are companies out there, some pharmaceutical companies, that are willing to dispense drugs for nominal fees in hopes that they can gain the notoriety, gain the perception of, um, a successful drug on the market. And that's a goodwill type approach, I guess, from a pharmaceutical standpoint. We also know that there are some hospitals that will give discounts or consideration for cancer patients. Some providers will do that, medical providers. Uh, I'm going to go back for just a minute because I was very curious with my the Ibrance, and I was very curious because my oncologist She had prescribed me a 20-day prescription, which was filled through the VA. But she happened to mention that it was a very expensive uh, medicine. So I Googled it. I wanted to know if I could find out how expensive it was. And it came up to a 20-day supply being around 12,000 and some change. And I thought, oh my God, how can anyone afford this? Nobody can unless you have insurance. And even with insurance, you're going to have astronomical copays, and you have your premiums that you have to pay most likely, or what have you, and then you have a deductible, and I mean it just all adds up. And if you're like I was, there's no way you could work, so you're out of that income, and it's just an added bonus to this, and it's not a bonus. It's not anything that we're going to find glee over, because it just doesn't exist. Not when you're talking these absurd amounts of money for something that could potentially save our life. And to me, it's almost sinful